So, hi, my name's Kelly. I'm going to be your pharmacist today. How are you?
I'm doing good. I'm just a little bit confused. Why was I told that you wanted to speak with me? I really just feel like I don't need to talk to you since the doctor has already told me everything I need to know about my medications.
Yeah, I just wanted to take like 5 to 10 minutes of your time to go over your new prescription and your refill, just to make sure you don't have any questions or concerns before starting your new medication. Is that okay?
Okay. Yeah, that should be okay.
Okay, and you're picking up for yourself, right? You're not picking up for anybody else?
Yeah, it's for myself.
Okay, great. If it's okay with you, I'd like to start off by verifying some of your information.
Okay.
Okay, can I just get your name?
Yeah, sure. Chris Aduga.
Okay, and then your birthday?
123 Huntington Avenue in Boston.
Okay, your birthday, sorry.
Oh, sorry, I thought you said address. My
No,
birthday was October 15th, 1980.
okay, great. And then what medical conditions do you have?
Sure. So I have high cholesterol, blood sugar, and acid reflux.
Okay, great. And then what prescription medications are you taking besides these two?
I just take these two.
Okay, and then what allergies to medications do you have?
So I'm allergic to sulfa drugs.
Okay, anything else? Just that?
Just that.
Okay, all right. And then what over-the-counter medications do you take? So like Advil, Tylenol,
I take Nexium.
Nexium? Okay, all right. And then what, if any, herbs, supplements, vitamins are you taking?
I don't take anything.
Okay. All right, so if it's okay with you, I'd like to start off with your new prescription, and this is atorvastatin. And
Okay.
what did your practitioner tell you that this is used for?
For my cholesterol.
Yep, so it's supposed to help treat high cholesterol and bring your levels down. Have you taken this medication before?
I'm not sure, but I don't think so.
You don't think so? Okay, we'll still go over it and just make sure we're on the same page.
That sounds good.
And then how did your practitioner tell you to take this medication?
I think once a day.
Once a day? Yep, so I have
Hmm.
you as 20 milligram tablets, one tablet once a day. And then you have 5 refills. Okay. And where are you planning on storing this medication?
I haven't decided yet.
Yeah, I usually say the best place is like a kitchen cabinet or a side table, somewhere the drug is going to be protected. So like a cool, dark, dry place, but also somewhere
Mhm.
you're going to remember to take it. If you did miss any doses, that's okay. I know life gets in the way. So just take it whenever you remember. I usually say like a good way is like a halfway point. So if you usually take it at 8 a.m., you have 8 p.m. to take it. But if you forget after 8 p.m., just take your next morning dose. You never
Okay.
you never want to double up on any of your medications because we just don't want to have any issues or reactions or anything like that.
Okay.
Okay. All right. And then what did your practitioner tell you to expect with this medication?
Not much. Something about my liver and muscles, which sounds pretty terrible. I don't want to take something that's going to kill me.
Yeah, I can totally understand how this could be scary, especially it's because it's a new medication, so we don't know how your body's going to react. But
Hmm.
those are some of the like the less known, like they don't happen as much as often. We do want to be aware of that though. Some other things are like an allergic reaction, because again, we don't know how your body's going to react. So look out for like any fevers or rash or itching. You'd want to call your doctor right away about that and get you switched off of it. Also, less serious side effects, diarrhea. Maybe mention it at your next appointment if you notice that more often, but not as serious. And then also with your doctor's appointments, you're probably going to have lab tests just to see where your cholesterol levels are at and see if this is working for you. So it's really important to stay consistent on your medication and take it every day like you're supposed to. Okay.
Okay.
Just to make sure I went over everything and didn't leave anything out, can you tell me how you're going to take this medication?
Right. So you said for this medication, I should just take one pill once a day.
Yep, so you're going to be taking that 20-gram pill once a day. If you miss any doses, that's okay. Just take it whenever you remember. Never double up on any of your doses, though. Okay? Okay. And then what questions do you have for me about this?
So I was just wondering if this medication interacts with Tylenol. I heard on that TV show, The Doctors, that Tylenol goes through your liver. So I was just wondering, like, is it
Yeah,
affected?
I'm actually not aware of off the top of my head, but I can look into it for you and give you a call back if that's okay. I just want to make sure I have the right answer before telling you either way.
That's
But right
okay.
now, it's safe to take.
Okay, good.
Okay. All right. So let's move on to your refill. So this is
Mhm.
metformin, and what have you
Mhm.
been taking this for?
For my sugars.
Yep, it's supposed to help lower your glucose levels. Okay. And how have you been taking this?
I take it in the morning.
You take it in the morning. So I have you as 500 milligram tablets, one tablet twice a day. So it
Mm-hmm.
actually looks like you're supposed to be taking it maybe in the morning and at night, so twice a day.
Mm-hmm.
And I also noticed that you haven't been picking up your refills on time. So I was just wondering, any obstacles getting in your way and what's been stopping you from getting into the pharmacy and picking it up?
Sure. So, well, honestly, I do skip some doses here and there.
Hmm. So what I hear is you skip doses. Is there any particular reason or just you're forgetting?
Yeah, well, honestly, like I just don't see how this medication is making me feel better. I don't feel any different than before from when I started taking it. And in fact, like recently, I've been told to stay away from certain foods, and that's been making me feel a lot worse.
Yeah. So I hear what you're saying. You said that you don't like taking it because you don't really see anything, or maybe your symptoms, you don't even have any symptoms, or it's not even going away and you have those concerns. I totally understand that. I can totally understand how you're feeling and not wanting to take that medication because maybe you don't think it's not working. But just know that this is one of those medications that you can't physically see, but it is working for like working in your body on a level that you can't see. So it is really important to stay on this medication. Also with this medication, I'm sure you're aware of like diabetes is a serious disease. So we just want to prevent any future complications that can arise and any issues down the line. So it's really important to stay on this medication. So again, we're going to be taking 500 milligram tablets, one tablet twice a day. So if it's okay with you, I'd just like to set up a plan and see if this month we can be consistent as possible. And then I'll check in with you later on down the line, maybe towards the end of the month when you come to pick up your next refill and just see how it's been going for you.
Okay.
Is that okay?
Yeah, that's fine.
Okay. And then what did your practitioner tell you to expect with this medication or any side effects besides just not wanting to take it?
Yeah, so I have been having like my stomach has been getting really upset when I take it.
Yeah, so I do see that like diarrhea and gas is one of the less serious side effects with this. You can mention this at your next appointment with your doctor. If it's really getting in the way of your life, I'd suggest you mention it. Some other serious side effects are any trouble breathing or lightheadedness. You would want to call your doctor right away about that. Again, this is a medication where lab tests are important, so it's really important to stay consistent on the medication and just take it like you're supposed to, just to make sure your glucose levels are where we want them to be and we don't have any issues come up.
Okay, thank you.
Yeah. And what questions do you have about this, or just in general?
I don't have any other questions.
Okay. Do you feel okay about your medications? Yeah. Okay.
Yeah,
If you have any questions, you can always call me at the pharmacy or come into the pharmacy. I'll be happy to answer questions that you have. Thank you so much for meeting with me today.
thank you.
Okay, have a good day.
Thanks.